Good morning. I'm Dr. Sean Coomer, Chief Medical Officer at the University of Kansas Health System, and also working in the Medical Center. This is Open Mics with Dr. Coomer. We're glad you are joining us today as we celebrate a rare milestone and the real impact it's having on patients' lives. 2 years ago, we celebrated the 1,000th patient to receive a groundbreaking procedure here in Kansas City, Kansas, one that eliminates the need for blood thinners. And today, we're marking another milestone, the 600th patient at our Olathe location. Millions of Americans take blood thinners or anticoagulants to prevent blood clots. However, they're not a good fit for every patient. There is an alternative. It's called the WATCHMAN procedure. Alexis Del Cid introduces us to Joe Meyers.
We do some crazy stuff.
79-year-old Joe Meyers and his wife Norina share a passion for hiking.
Go up slots, come down rocks.
And enjoy traveling the world doing it.
We do get out quite a bit.
Whether it's Switzerland.
It was just unbelievable.
Croatia.
Croatia was great.
Or various places across America, they live for adventure.
Hiking is just the best.
But it was a hike in Colorado about 6 years ago that took the couple on an unexpected detour.
We'd almost gotten to the top of our hike, and Joe just became very short of breath, and he knew there was something wrong. And so we had to not crest the top.
I lost energy, and I felt tired, and I knew there was something strange going on.
They returned home and were referred to electrophysiologist Dr. Ravi Yarlagadda at the University of Kansas Health System Olathe campus. Dr. Yarlagadda diagnosed Joe with AFib, an irregular heartbeat that can often lead to strokes, blood clots, or even heart attacks. Joe underwent 3 ablations, got a pacemaker, and went on blood thinners to reduce the risk of clots. But blood thinners come with their own risks, especially when you're as physically active as Joe and Norina.
The doctor just really was very concerned about Joe being on the Eliquis in case of a fall, could have a brain bleed pretty easily.
So Dr. Yarlagadda suggested an alternative, a device called the WATCHMAN. He would implant the device into the left atrial appendage of Joe's heart by going through a tube in Joe's leg. The device would seal things off, preventing blood clots from getting through, eliminating the need for Joe to be on blood thinners at all.
You can eliminate off the list of what can kill you. Something else might get you, but not that.
And it turned out, Joe would also make a little bit of history.
Oh, he says, Joe, you're my 600 WATCHMAN procedure patient. And I said, oh, okay, at least you know what you're doing.
And of course he said it with a huge smile. He comes walking in, throwing open that door and saying, you're not going to believe this.
Joe says he had the procedure in the morning and went home a few hours later feeling great. The hardest part, following the doctor's orders post-procedure for the next week.
The doctor told me don't do anything crazy because he knows I'll go right out and get on the bike or start walking again.
It was not easy, and I would have to say, you remember what the doctor said, Joe, so don't go out there and do that.
Today, Joe is back on track, and he and Norina are planning their next hiking trip, this time to Sedona, Arizona. His message to anyone else on the same path he was on years ago?
You know, hindsight would say, get it done.
Well, we're so pleased to have Joe Meyers and his wife Norina join us here in a KCK studio. Thanks for being here. Joining us from our studio inside our Olathe campus is Joe's doctor and electrophysiologist, Dr. Ravi Yarlagadda, and Becky Johan, a director of our perioperative procedural services. Good to see everyone, especially you, Joe.
Oh, thank you.
How you feeling?
Good to be here. I'm feeling just great.
Great. So you got this huge announcement from Dr. Yarlagadda before you went to have your procedure. You're the 600th patient to receive the WATCHMAN Olathe. But you underwent that procedure a while back. When was that?
The procedure itself?
The procedure itself, yes.
What was it?
October
Oh,
16th.
Yeah, right.
October
right.
16th, 25.
You're right.
Yes.
Okay.
I'm sorry.
Not that long ago, just several months
yeah.
ago.
Yeah.
Okay.
And so coming up to 6 months in April.
Okay, fantastic. Congratulations. So what difference so far has the WATCHMAN made in how you feel?
Well, I feel fine. You know, it's kind of a bonus. You know, nothing really changed in me. However, just knowing that, you know, if I fall down climbing or something happens when I'm biking, I'm going to have some. I feel safer that I can do those things and can continue to do those things without being in some canyon and I can't get out for several hours, and knowing that I'm not going to bleed internally, and that's always a positive.
Yeah. And so you were on Eliquis beforehand.
That's correct.
And you're still on it now, so you stay on that for 6 months after the WATCHMAN procedure, right?
Yeah, we're on, after the procedure, Dr. Yalagada put me on Plavix and a baby aspirin for the next 6 months.
All right. So, Narina, does this give you peace of mind, especially with how active you both are? We saw those pictures of you hiking all over the globe.
Yes, it really does, because, you know, we're both just very active. We just like to be out there doing things, and I hope we can for a long time. But this just makes me feel a whole lot better about Joe, even though it's harder to do some of the bending and things that, you know, but he's still doing it, and it's great. Yeah.
That's fantastic. So, Dr. Yalagada, what made Joe a good candidate for the WATCHMAN procedure?
You know, when you look at patients with atrial fibrillation, most of these patients are older. Joe, nothing against you, but you know they're older. So as all of us get older, the balance is really not the same. So the chances of patients having a bleed gets higher because your tolerance to any type of blood thinners gets bad as you get older. So with Joe's active lifestyle, especially with his passion about hiking and biking and so on and so forth, I really did not want him to have any bleed by being on such a strong blood thinner that he really needs because of his atrial fibrillation. So it's more his lifestyle that worried me, and I thought this would be a great safety net for him so that he can come off of blood thinners.
Right, but it's still, even without an active lifestyle, still with fall risk, even folks that aren't as active as Joe and Narina probably would benefit from this as well, right, Dr. Yalagada?
Absolutely. So typically when you think of patients with atrial fibrillation, most of these patients are elderly. They have comorbidities like gastritis or ulcer problems or balance problems where they fall frequently. So those are the patients who really benefit from being off of blood thinners. So typically those are the patients we screen to see if they would be candidates for WATCHMAN.
Great, thank you. Becky, what does recovery look like compared to other heart procedures?
You know, recovery is pretty simple, honestly, for this procedure because the access is through the groin versus an open heart surgery or anything like that. And so really just restricting what you do for a couple of days and lifting, have a couple hours of bed rest. Dr. Yalagada is able to send most of his patients home the same day, which is really fantastic. You know, you come in for the procedure, you get to discharge, you don't have to stay overnight in the hospital, which is amazing, and then get to resume your normal activities in a couple of weeks, really. And just be cognizant of the blood thinners that you're taking and follow up with the doctor, a few days afterwards, and then in the clinic for another check in 45 days. So really relatively simple recovery as compared to some of the bigger cardiac surgeries that are done.
Yeah, considering how complex this really is, even though it's done through a catheter, going home the same day is just amazing.
Yeah,
it's incredible.
Really great.
Yeah. So let's get to the basics, Dr. Yalagada. What is AFib? Explain how it makes a patient prone to blood clots.
So AFib is a very common heart rhythm problem, and it's really age-related. So when you look at patient populations over the age of 75, a significant portion of them have atrial fibrillation. So atrial fibrillation happens when the upper chambers of the heart beat very irregularly. So blood tends to pool in the upper chambers of the heart, and pooling of the blood is bad because that's where clots form. So atrial fibrillation originates from the left upper chamber of the heart. There is a structure called the appendage, which is a finger-like projection that kind of stays in the left upper chamber of the heart. It really does not contribute to the heart function. It is kind of akin to the appendix in our intestines. So it is in that finger-like outpouching where the blood tends to pool and eventually clots in patients with atrial fibrillation. And because the appendage is connected or opens into the left upper chamber, that's where the clots arise and they go to the brain from there. So this procedure, WATCHMAN, essentially eliminates that communication between the appendage and the left upper chamber of the heart. So it's basically placing a filter in the left upper chamber that filters out the clots so that they really do not, go to the brain.
Okay, great. Thank you. So the atrial fibrillation is the atria are just not contracting normally in this situation, correct? And that's why you have the pooling and the blood clotting, correct?
That is correct. Yeah.
Right. So Becky, how do you measure success? Reduce stroke rates, reduce bleeding risk, patient satisfaction?
Absolutely, all three of those and more. I do think, just being able to discharge our patients the same day is really amazing. That's definitely a patient satisfier. When patients are in the hospital longer, they're more susceptible to other infections and other things, and the best place for people to heal is at home. So we do look at stroke rates. We report things to our registries and keep a good eye on them. Our outcomes have been very good for these patients, and we measure them regularly. We report out regularly and just make sure that our patients are well taken care of.
Yeah, care close to home and healing home.
Absolutely.
That's awesome. So we have a video from a different patient getting this procedure and animation that shows the WATCHMAN being inserted into the left atrial appendage. And folks, although animation makes the WATCHMAN look very big, it's actually about the size of a quarter. Dr. Yarlagadda, can you walk us through this procedure?
So this is a catheter-based procedure. We put a catheter through the patient's right blood vessel in the right groin. It's called the femoral vein. You snake this catheter up into the heart. The catheter is about 8 French, and once you go into the heart, we get into the right upper chamber of the heart. We use a needle to cross the septum or the wall that separates the right to the left upper chamber of the heart. And then we implant the device in the left upper chamber of the heart and then remove the catheter. So when you look at the WATCHMAN device, it's as you rightfully said, it's almost it's as big as a quarter, but you can't really deploy that from your groin. So it really comes crumpled like an umbrella. So once you get into the left upper chamber of the heart, you open the kind of umbrella and advance it into the left appendage, which is where it resides in. So the key thing is to implant it in the left upper left appendage so that it really does not go anywhere else. So in the video that's shown, you actually see the appendage being closed with the WATCHMAN, and the sheath is in the left upper chamber of the heart.
So I understand that 95% of the time, patients who undergo the WATCHMAN can successfully come off their blood thinners. Joe, we mentioned you're still on blood thinners here for a little bit, and you're hoping to come off them at 6 months post-procedure after your follow-up, Dr. Yarlagadda. But you're still on them, but you expect to come off them. Is that right?
Yes, I understand. With my 45-day checkup, I was doing very well. I think there's a skin or something that goes over it, and there wasn't any leaks. Looked good, so that was very positive to know that at 45 days. So April will be the next checkup. So.
Well, we'll be crossing our fingers for you to come off of those, so you are pretty active. Narina, based on everything you've been through with Joe and his heart, and coming from a wife's perspective, would you recommend the WATCHMAN to other people walking in your shoes?
Oh, absolutely, especially, as was mentioned, we're all getting older and we can fall pretty easily. I mean, it happens a lot, so I would certainly say it's worth it.
So speaking of walking, you and Joe love to hike. In fact, when we asked you both to join us today, Joe answered his phone on top of a mountain. You sent us some pictures. Tell us a little about where you are and where you like to hike and why you like to hike.
Well, in wintertime, we like to get out of Kansas City, try to avoid the weather. So we go to Sedona, Arizona. We've been doing that for approximately 15 years. And it's not the typical hiking you would think, simply walking on a trail. We get off the system trails and start rock scrambling, going up and down slots. And so it's so easy to get bruised or punctured by a cat's claw or slip and hit your head on a rock. So having this procedure gives me a little bit more peace of mind if I'm not so sure-footed climbing up around the mountains to see Indian ruins and so on and so forth. So that's every every winter we've been going out there, and it's all related to hiking and climbing. Other places, we did a hike in Croatia this past year, a little bit easier, not scrambling on rocks and going up slots, mountain slots. And then we have another trip coming up in May to hike southwestern Ireland, and so we love to hike, and when it gets warm out, we'll be on our bikes around here in Kansas City.
All right. Well, we'll talk offline what rock scrambling is. I'm not sure what that is, but
all right.
I think there's a lot of pressure on Dr. Yarlagadda to get him off of Eliquis at his next appointment. So we're here to answer your questions. Please send them in using the links on your screen, YouTube, Facebook, or email the Medical News Network. Let's check in with Doc Hawk. Dr. Hawkinson, let's start with a look at the respiratory virus season. How are things starting to wind down?
Yeah, well, first of all, I'd like to say whenever I'm out at Olathe, it's always good to work with Dr. Yarlagadda. So just great practice partner for sure. Going back to respiratory viruses, so we are overall seeing a decrease nationwide, which is good. Certainly the last few weeks it's kind of been stable with still high to moderate. But right now we do have a graph with showing the percentage of people, and we've seen this before. This is for ILI, or influenza-like illness. So we show this graph, and this is for people who are seeking care for influenza-like illness. You can see in the red line, which is this year, compared to last respiratory season, which is the orange line, you can see where we are right now, and that's that last data point. So there was a large peak in the last couple weeks of December, early weeks of January. Since that time, we have gone down, and we are certainly currently going down right now. So that is overall good. Less and less people seeking care for influenza-like illness. Unfortunately for this season, we have still seen 26 million illnesses, 340,000 hospitalizations, and over 21,000 deaths from influenza so far this season. Unfortunately, we have also seen 90 reported influenza-associated pediatric deaths. And we should note, Sean, that approximately 85% of those reported pediatric deaths this season were in children who were not fully vaccinated against influenza.
So, kind of a big deal. That graph we showed, you know, we tend to get those bimodal peaks in previous years. Previous year we did.
Yeah.
We didn't see that this time. What do you think that was due to that?
Yeah, you know, it is variable, and I should say that most of the time we do expect that, and typically what that is early in the season, again, in a typical year, you'll have an influenza A strain coming through, which we did this year. Later on, you can have more of an influenza B strain that may kind of pick up predominance and come through. We certainly haven't seen it. We are now nearing the end of respiratory viral season, which is April 1st, essentially. So we haven't seen it. That's a good thing. But we know that in general, this past few weeks, there has been an uptick in influenza B isolation in people who have come in with influenza. But again, overall, influenza-like illness is decreasing. And I would just say, going back to those influenza, those pediatric deaths, we do know that influenza vaccine does help reduce the chance of those severe complications and deaths as well. I would also like to point out, for the first time in the last 3 months, we haven't really talked about COVID, but right now at our health system, COVID admissions have overtaken influenza admissions, and you can see this graph, which we showed before. The blue lines, our bars, are influenza admissions. Orange is RSV admissions, and green is COVID admissions. So you can see there that for the majority of the past few months, it has been influenza admissions, which have been more predominant. But right now, this past week, we have seen more of an overtake by COVID, but that doesn't mean that COVID circulation is high at this point. It still does remain low, but we know, unfortunately, there is not necessarily a specific seasonality to COVID, so that can increase in circulation at any point in time. But right now, overall, I would say that respiratory viruses circulating is improving locally and around the country.
Well, thanks. Let's shift over to the shingles vaccine. It's making news for possibly lowering the risk of dementia. What are we learning so far?
Yeah, well, I think this is another great important point. So we all know that vaccines can provide benefits just beyond the organisms to which they are targeted, whether that's influenza or COVID or measles, mumps, rubella. For instance, we know that the HPV vaccine essentially prevents cancer, and this is preventing cancer caused by those viruses. In addition, now we also have further support for the shingles vaccine's role in helping avert or delay dementia diagnosis. And this is a study done in Canada from Canadian researchers who evaluated dementia rates before and after the start of a shingles vaccination program in Ontario. And they found that dementia diagnosis among birth groups who were eligible for herpes zoster vaccination, again, that's shingles vaccine, and that is typically people who are over 50. These dementia diagnoses were less common than other provinces who did not have a herpes zoster vaccination program, because Ontario had a specific program to target patients who were eligible for herpes zoster or shingles vaccine. And so they were doing that program, and what they found was more of a delayed or less diagnosis of dementia compared to other provinces in Canada which did not have that program.
I mean, it's very interesting. The common thing is you get your vaccine.
Yeah.
It's not an absolute cure or prevention, but it attenuates and sometimes eradicates. But I think that leads to the next thing here. We talk about measles. Measles has come back, but people stopped getting vaccinated.
Yeah.
So last week we were notified by Kansas City, Missouri Department of Health about a single case. Where do we stand today? We've had a lot of these around the country.
Yeah, certainly we know that as of the last CDC update, the number of measles cases in the United States for this calendar year, so 2026, increased to 1,281 or 1,281. And of those cases, 93% of those are unvaccinated or unknown vaccine status. So in regard to the measles case reported in Kansas City, Missouri last week, unfortunately, there has been no new updates on further cases. So hopefully that is a good thing. We know that there was that informational put out by Missouri Department of Health and Kansas City, Missouri Health Department. But what I would say that if you are not immune or vaccinated against measles, there still remains time to start that vaccine series.
Yeah, I mean, honestly, a lot of folks that trained after us have never seen a case of measles, right?
For sure.
It's just kind of amazing. Now they're starting to see them. So
Yep.
We know many of you have questions, so let's head to Studio B with Alexis.
A question for Dr. Yarlagadda from Jeremy Yenser, one of our loyal viewers. Jeremy wants to know, when you're installing a WATCHMAN device, is that a standalone procedure, or can it be done at the same time as something else, like an ablation or valve work?
So that's a great question. So a WATCHMAN device is usually done standalone, but in the past year or so, we are doing something called concomitant cases, where we do an ablation and a WATCHMAN together at the same time. So access to the left upper chamber of the heart, which is the integral part of a WATCHMAN device, is the same part we use for ablations as well. So doing a combination of a WATCHMAN device and an ablation procedure certainly decreases the amount of time you actually spend in the lab, as opposed to doing it as two separate cases.
I have a question for Joe and Norina. Actually, Joe, you said something about how you have to be careful you don't trip on cat's claw. I'm not a hiker, but what's cat's claw?
Well, it's when you're hiking off trail, you're kind of scrambling around to get to the top, to simplify it. Well, there's no trail there, so you see, yeah, I want to go up there, but this is the way I have to go to. So you're going through a lot of shrubs, and there's all kinds of different shrubs, and in a desert environment, they're pretty durable, and so when you rub up against them or you slip a little bit and you hit the side with your arm or even your head, that's something you want to avoid. So it's a little bit more challenging to hike and to get up to a certain location. And so it takes a lot of extra effort, but it's not a clean trail. You're just scrambling up there trying to get to the top to see the beauty of the country you're looking at. And so that's what you want to avoid. Easy. Now you can usually see on my arms when I come back from a hike, I'm either bleeding or on my shins, and so I get accustomed to that. But we try to avoid that, but in some locations you just can't. You're just hanging on to trees, trying to get up a slot, going up, and you're just banging this stuff.
Joe, we should probably ask Dorina if she has as many cuts as you do, and maybe you're just injury prone here.
I am clumsy.
Well, and he's a little bit bigger than I am, but yeah. Well, clearly that's why
I have a tendency to run into stuff.
That's why they wanted to get you off the blood thinners. And actually, Beth has a question about blood thinners. Beth wants to know if there are long-term risks to staying on blood thinners other than a fall risk and the bleeding. Are there long-term risks to the blood thinners themselves?
No. So the major concern with these blood thinners is the fact that you are on a blood thinner. For example, if you were to fall or if you were to have any increased predisposition for example, gastric ulcers or something like that, you tend to bleed a lot more. One of the common questions that's asked is, what happens if I'm in an accident or, if I were to have something like that? Obviously, you're going to bleed a lot longer. So apart from bleeding risk, I don't think there's any other more risk for being on a blood thinner.
Eric has a question. He says he thinks he's a good candidate, but he's never heard of the WATCHMAN before this program. So who does he call to figure out if he should get one?
So Becky, you want to take that?
Sure. Yeah. No, I think it would start with your primary care physician. So initially you would want to talk with them about your signs and symptoms. They can refer you to a cardiologist if that's indicated, or electrophysiologist, and you would have a clinic visit. You can also look online for contact information for our physicians, and we have a care coordinator that can coordinate exactly that. If that's what you're needing and your indications line up, you are a good candidate. Then our coordinators will take care of everything to get you scheduled. We have a comment from Joellen McGranahan, one of our viewers. She writes, I forgot that I even had the WATCHMAN. I'm coming up on 2 years since insertion. Well, that's good. It's so easy she forgot she had it.
That's a good thing.
That's the point, right? That's perfect. Yeah. We hope Joe forgets soon, too.
Yeah.
And Jeff has a question. Jeff wants to know if Joe's WATCHMAN will ever need to be replaced after a certain amount of time, or if this is a one-time thing.
This is truly a one-time thing. It really does not need to be replaced at all.
So this has been a great discussion. I'm grateful to our guests for being here, but I'd like to get some final thoughts before we go. Joe, we'll let you kick it off.
Well, I'm very thankful that I had the procedure. I know Dr. Yarlagadda talked to me one time. He says, Joe, I'm sure you're tired of surgeries. Well, I've had 5 knee surgeries, and that's maybe related to always bending down because I'm tall, or my running career, which I've been a past runner, but that ship has sailed because of my knee surgeries. But I'm just, it gives me, a little peace of mind about, I have a little safety protocol now that I know that I can be someplace and which would be very difficult to get me out of, that I don't have to worry about bleeding internally if I do have a hard fall or something related to it.
Dorina, you've got the hardest job here, is trying to slow this guy down for a few months. What are your final thoughts?
That is so true. Well, I'm just really glad he's had it, and anxious for him to get off the rest of those blood thinners, and he'll be safe. Yeah.
Becky, what outcomes are you most proud of in your program?
Oh, so many things. Besides the fabulous physicians that we have here to take care of our patients, the quality of life that I can see that's happening right now in front of you. And also we've been recognized by U.S. News World Report as a high performing arrhythmia group. So that's just really fantastic. That was the one that we had here at Olathe, and really excited about that. Also just taking care of our patients every single day, low risk, getting them home, getting back to what they need to do and what they love to do. So I think quality of life, definitely.
All right, thank you. We're really proud of the Olathe team, that's for sure. Dr. Yarlagadda, give you the last word.
So, the reason why we are here is our ability to do these complex procedures close to home, right? That's what medicine should be about, is ability to treat patients closer to where they live, and ability to offer complex medical procedures in a safety environment, even in a community setting. So that's what we are all about here in the Southwest Campus. And we are very proud to offer this to our patients. We do the entire gamut of cardiology procedures here, on par with any other bigger institutions. And the best thing is, we are much closer to where our patients live. So that's what we are very proud of.
Yeah. Well, thank you, Dr. Yarlagadda and Becky. Thank you for all you do there. You do a great job. We're really proud of you both and your whole team.
Thank you.
Thank you.
So let's get back to Alexis to hear what she's working on for tomorrow's show.
Thank you, Dr. Coomer. Coming up tomorrow on All Things Heart, it's a second chance at life. We share one man's journey from a dangerous heart problem to a heart transplant. You'll meet the care team that got him home and back to living the life he loves. That's tomorrow at 8 a.m. on All Things Heart.
Well, thanks again to all of our guests and to our audience. And remember, faith, hope, and science.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.